Thank you, Colette. Listen, I'd like to welcome everybody here today. It's such great to see such a crowd. The West and the Northwest is very much awake at the moment, so it's good to see such an attendance today. I suppose today is a learning set which is specifically designed for those working and living in the areas covered by the CHO1 and CHO2. Today is very much a national initiative and is a follow-on also from a previous learning set that took place in Sligo in February 2017 called Making Recovery a Reality. The learning set format today sets out to bring together all the relevant stakeholders, people who use our services, their families, community groups, and with those who deliver services in order to share information and experience, learn new ways of working and problem solving, and to enable our mental health services to become more recovery focused. The theme for today is called Recovery Together It Happens. And this theme very much stresses the importance of collaboration and inclusiveness. We cannot accomplish truly recovery-orientated services without us all working together, and each one of us here have an equal contribution to make in the development of recovery-orientated services in our areas. So really, I suppose what's going to happen today is that the learning set will focus on the 4 principles identified in the National Recovery Framework, namely the centrality of lived experience, co-production, organisation commitment, and recovery and learning practice. So very much what we can expect from today is that we'll hear from a number of speakers, and there'll be a number of discussion panels, and there'll be a number of exhibitions that we can see. I suppose first up will be Michael Ryan, the Health Engagement and Recovery, and I'd like to take this opportunity to congratulate Michael on his recent appointment to the National Head of Mental Health and Engagement. I've worked very closely with Michael over the past number of years, and he very much has become a leader in this area, both in service user engagement and in the recovery agenda. So listen, Michael, I'd like to congratulate you on behalf of everybody. And Michael will go into more detail on that. Then I suppose there'll be an opportunity to attend some workshops, and then we'll have, which was very successful the last time in Sligo, was very much a brag and steal, which is an opportunity for the services maybe to showcase the very good practices that are happening. And there's a lot happening throughout the services, so it's an opportunity to go see them and bring them back to our own areas and learn from each other. Because the learning set very much is about our opportunity to come together, share experiences, and learn from what's working well in other areas. I suppose since we last met in Sligo, there was a number of actions came out of that day, and again, as part of that, I think we are beginning to make progress in terms of making our services much more recovery orientated. Again, we're all working on the framework implementation plan. The services are very much working with the SRF to try and maybe get new initiatives up off the ground, and working with the services themselves in trying to restructure and reshape our services, moving from more traditionally structured services into much more recovery orientated. Again, as we all know, that's very much a journey, and this is very much part of that journey. Across the services, we also have new housing project managers. We have new individual placement officers. We have peer support workers are becoming more bedded down. I think there's increased education and awareness both among people who use our services and our staff in terms of what recovery-oriented services are happening. Again, in our own area, there's more training in terms of peer support workers. And also we're very much trying to address a lot of the legacy issues that we have in mental health. And really the legacy issues are about really changing the way we deliver services in order to try and create a new model and a new, much more recovery-oriented service. And again, the feedback from occasions like this will feed back into the services in terms of how we do this better and how we actually can really make our services more recovery-oriented. Also, I think a really positive development since we last met is the development of local service forums are growing. And I know Colette in our area, and probably Patrick as well, we're beginning to develop a network of structures to give service users a really meaningful input into our services. I know in our own area, Colette sits on our area management teams, and again is driving the agenda of what service users are saying on the ground. So I think the development of forums and trying to integrate them within the actual structure within our services is a very important development in terms of making getting the service users' voice in and ensuring our services are more recovery oriented. Also, I suppose very much we have to take cognizance of what our service users and our staff are saying, and recently we've done a number of surveys of staff, and what people are continuing to tell us is, yes, that we are going in the right direction, but we have a lot more to do. We need to provide access to better quality services more at a time. This is what people are saying to us, and we know this, and this is part of the agenda that we need to try and drive forward. The increase in availability of non-medical therapies. There's lack of sufficient community-based services, and people talk a lot about the lack of options, that we need as service providers to be able to provide a wider range of service options, not just a traditional medical model, but we need to be able to look at a much more holistic and broader approach to mental health. Our service users are also in timeless that we need better information and signposting and communication with service users, families and services. We're also very been clearly told there's a lack of 24/7 services, and that the over-dependency on A&Es and when people are in crisis isn't working for people, and we need to start looking at new ways and new models that we can actually try and do in terms of, I think all these will help us actually ultimately provide a more responsive service to the needs of service users. We also need to value service user expertise in the whole area of both the management of our services and the development of services. And I think the whole issue about how we actually recognise that and how we reward that, and that we actually do that in an equal way, and the whole issue about reimbursement and that is a key issue that we're trying to get addressed. And I know it's something that we're looking to try and do within CHO, and I know there's a national initiative, but we really need to get that right in order to actually improve participation. I suppose today I'd like to acknowledge the work that's been done by the Learning Set Planning Group. I'd like to thank the group who kind of was a co-produced group across CHO 1 and 2. The group was made up of service users, family members, service providers and NGOs. The role of the group was to plan, and we must thank them for their hard work in actually bringing this together today. So the fact we have such a big number here, we estimate there's probably 230, maybe 240 people here, so it's really, really great. So I'd like to sincerely thank the group who's organised this to bring it to fruition. And I suppose in conclusion, this process that we're involved in, the process of learning sets, the development of the National Recovery Framework, the implementation of that locally, is very much reaffirms our commitment, I suppose, to continue to work to move from a traditionally institutional-based model of mental health service towards a really recovery-oriented focus that will be clinically excellent, that involves service users and their families in all aspects of the design and delivery of service. And I suppose that's our commitment, and how we do that is part of what we're trying to do here today. Another important element today is the informal engagement. It's very much about kind of friends coming together with colleagues from around the neighbouring counties and to continue to learn from each other. So listen, so the informality of the day is very, very important. So mingle, chat and enjoy the rest of the day. Thank you very much.